Welcome back to our regular viewers, and thank you for joining us for our second episode of the season if you're new to this podcast. This podcast is for behavioral health clients and consumers, advocates, allies, peer support workers, community health workers, where we talk about advocacy, recovery, peer support, and provide education related to legislative changes to statewide policy to empower you as a client, consumer, or an ally to lift up your voice as a stakeholder in the public behavioral health system. With me today are my incredible Access program teammates.
Hi, I'm Grace Gallagher.
And I'm Jocelyn Farrell.
And I'm Nicole Chilton. If you're new to our podcast, a new peer ally, or new to the workforce, we're so glad we found you. And to help level set, let's talk about peer support and the public behavioral health system. Peer support specialists, also known as peers, are individuals with personal lived experience of mental health or substance use disorders or family members. Peers utilize their lived experience to meet individuals where they are on their journey, whether that's just starting or overcoming barriers to maintain long-term recovery. Peers practice as paid staff or volunteers within community-based organizations, peer-run organizations like us here at Cal Voices, recovery centers, county operated services within the justice system, and so much more. In their non-clinical roles, peers provide emotional and recovery support, service navigation, harm reduction education, lead wellness groups, outreach, and offer mutual aid, which is the foundation of peer support in the grassroots efforts of the recovery world. Peers may be matched with individuals based on experiences of mental health and or substance use, language, race, military background, age, or any other shared commonalities. The peer workforce is made up of non-certified peer support specialists and certified Medi-Cal peer support specialists. As of this week, pulled from the Certified Medi-Cal Peer Data Dashboard with California Mental Health Services Authority, there are 6,677 certified peer Medi-Cal peer support specialists throughout California. That number, although there are over 6,600 certified peers in the state of California, this number does not reflect the workforce who are not certified as Medi-Cal peer support specialists. Certified Medi-Cal peer support specialists follow 17 core competencies, 16 ethical standards, Substance Abuse and Mental Health Administration, also known as SAMHSA, 12 core competencies, and provide services that align within the 3 areas of their scope of practice as billable providers. So we want to talk a little bit about how peer support is different from clinical services. Peer support rooted in recovery practices and is peer-centered, providing supports to consumers. I need to redo that. So we want to take a moment to look at how peer support is different from clinical services. Peer support is rooted in recovery practices and is person-centered, providing supports to consumers. The other side of that are clinical services. Clinical services are rooted in the medical model and centers the diagnosis of an individual. Recovery within clinical services is based on symptoms being reduced and or completely absent after treatment. Within the person-centered model, individuals are supported with identifying ways to treat their symptoms based on their needs, as their own personal expert. They know what they need best. And that may include cultural traditions, changing their diet, or engaging in activities that promote long-term recovery and wellness. So the public behavioral health system integrates the medical model and the recovery model. So what's the public behavioral health system? It provides mental health and substance use disorder services and is made up of county-run programs, federal Medicaid funding, which in California is known as Medi-Cal, or Medi-Cal managed care plans, and community-based organizations. And due to legislation passed through Prop 1, the system is going through a variety of changes impacting individuals receiving public behavioral health services. And so we'll dive into that, into a reflection of how peer support service providers in the LA region are being impacted by the transition from the Mental Health Services Act to the Behavioral Health Services Act in our August podcast. So please join us next month after our behavioral health transformation workshop with our LA partners as we dive into that a little bit more. So now that we provided a brief, very brief overview of peer support, what are some practices for integrating peer support in the public behavioral health system? Jocelyn, we know peers follow core competencies within their practice. What about peer support supervisors?
Yeah, so in addition to those core competencies that you were mentioning for peers, there are 11 core competencies for peer employers, which shape and inform the best practices for peer support within the behavioral health system. So those competencies include things like a recovery-oriented work culture that values the unique contributions of peers, dedicated and influential workspace leaders committed to peer-provided services, supportive managers and supervisors willing to coach peer staff, adequate oversight, evaluation, and feedback for peer positions, clearly defined roles, and genuine opportunities for career advancement, collaborative working relationships amongst staff, both peer and non-peer, and workplace infrastructure that supports continuity and growth of peer programs.
So you listed recovery-oriented culture. Can you share a little bit more about what that means?
Yeah, of course. So when we talk about a recovery-oriented culture, we're talking about something that's more robust than that traditional medical model that you were referencing earlier. So in a medical model, like you said, a person might be considered recovered when they reach a certain level of symptom reduction. But when we talk about recovery-oriented services, we're looking at a person's entire well-being and their ability to live a fulfilling life in alignment with their own values. There's 3 criteria that need to be met for services to be considered recovery-oriented. First off, it's person-centered. So we look at someone as a whole person rather than defining them by their illness. It's client-driven. So we put the client in the driver's seat where they're the ones that are making their own decisions about what they need to achieve recovery in their own way and in their own timing. And it's strength-based rather than deficit-based. So we don't look at what's wrong or what's missing from a person, but we look at the strength that they bring to the table, and then we support them in leveraging those strengths for their own recovery.
That strength-based approach is vital to peer support and meeting others where we're at. And I truly am so grateful that in this recovery world, we can rely on having that support throughout the system to continue to integrate peers in the workforce. So, in support of recovery-oriented culture and upholding the supervisor core competencies, can you share how the peer role is maintained in the working or volunteer environment?
Yeah, so it's really crucial that a peer has a very clearly defined role within their organization. A peer is not just like a less qualified or lower ranking version of a clinician, right? It's completely separate. It's an equally important role, but it is very different from the clinical side. And the value that peers bring to the workplace comes from the fact that they are trained and equipped to use their own lived expertise with recovery in order to come alongside somebody else in their recovery journey, in a way that's not always possible in the more clinical relationships. And so if peers aren't being placed in clearly defined positions that align with that, or if their role is restricting them from engaging with clients in that way, then their value as peers and what they bring to the workplace is going to be diluted. And as I was thinking about that this week and the value that they bring and why this role really needs to be protected and preserved, it was reminding me of aspects of my own recovery. And I was never on the receiving end of like official peer support services. But the kind of support that I did receive, I think really embodied the heart of peer work. And something that I've often said is a big part of my recovery journey was borrowing hope. And what I mean by that is that at so many points in the process, I didn't necessarily have my own hope or my confidence in my ability to move forward, but other people in my life did. And they lent me their hope in my recovery and let me lean on it when I didn't have my own. So again, I was never working directly with peer support specialists, but still, when I reflect on how powerful that was for me to have those people on my side who let me borrow their hope when I needed to, I think this highlights for me why it's so important to have peer support specialists in this work and to protect that role so that clients have that person on their team that has that unwavering confidence in their recovery and then who can lend that hope to the client.
Thanks, Joss. But hope and centering that in our recovery is incredibly important. And I appreciate you bringing that up and highlighting that because um, I think that also is just something that everyone can lean into and share, no matter what background we're coming from, is we all want to hold on to hope. So
Absolutely.
thanks, Joss. So Grace, we covered best practices. What are the benefits of peer support as an evidence-based practice and integrating peers throughout the public behavioral health system?
Yeah. So when we talk about transforming the behavioral health system, it shouldn't be about adding in these brand new systems that kind of come in and change everything while not being backed by research. This is an issue we see with the CARE Act in California because no studies exist to prove that a court order for outpatient treatment in and of itself has any independent effect on client outcomes. So we do know that it has been very costly and inefficient. So, what we should be doing is what we know actually works. And when we talk about evidence based practices, I think the focus is often clinical. And so, to actually answer your question, Nicole, what we know is that peer support, for example, is evidence based and it's backed by research. It's cost effective, it's proven to reduce hospitalization. People are actually less likely to be readmitted into the hospital if they receive peer support while initially admitted. People spend less time in inpatient care and have lower overall costs of services than anyone receiving standard care. Peer support also promotes increased engagement in services. So people actually want to engage in those services when they have a peer supporting them. And they also enhance social functioning and improve the quality of life and overall whole health of a person suffering with mental illness and substance use. So it's really important to elevate the voice of peer support because it's not just a feel good idea, it works, and there's data to prove that it works. And we're really starting to see the peer support world take a massive hit with the changes under Proposition 1 and also the cuts to Medicaid funding at the federal level. So it's really important for people to know that these vital services are losing their funding and they're going away. And these services really are and always have been essential to behavioral health. So we need them and we need to advocate for sustaining them. Yeah. That was kind of a roundabout way of discussing the benefits, but yeah.
Definitely. Sustainability of this workforce. Um, Again, leaning on into what you mentioned in the last podcast, nothing about us without us.
Mm-hmm.
And so being going through all these transitions with moving towards the BHSA, there definitely are those obstacles and challenges to overcome, and also the beauty of peer support, that hope, and having that evidence-based backing, it proves that it works.
Right.
So how could we not continue?
Right.
So now that we've discussed peer support, the public behavioral health system, the evidence base, and the benefits of peer support in the public behavioral health system, let's talk about how you, the viewers, can get involved.
So we are about to begin our tour of California for our behavioral health transformation workshops, our BHTWs. I think I'm finally getting that acronym down. And registration's open for those now. Our first event is in Los Angeles on on August 15th. And the registration deadline for that's coming up very soon on August 5th. Then we're going to head up to Northern California for an event in Red Bluff on September 18th. The deadline to register for that is September 8th. Then in the Bay Area, we have an event in Oakland on October 1st. That registration deadline is September 21st. Then we'll head back down to Southern California again to Costa Mesa on October 16th. And the deadline to register for that one is October 6th. And then finally, we're going to come home to Sacramento for our last event on October 30th. And the deadline to register is October 20th. So I know that was a lot of dates, but we will link our flyer in the podcast description, and all of those dates are included on there. And we also know that times are hard right now, and we don't want the financial barrier to be something that stops you from coming. So we do have fee waivers and travel stipends available for eligible participants, and those links will be on the flyers as well. We also have some webinars coming up if you're not able to come to an event in person. On September 25th, we have a training with Legal Services of Northern California. And on October 9th, we have our next policy update webinar, which we led by our policy director, Maron. And then in early 2026, we'll have our annual statewide conference. And if you're wondering how you're supposed to stay up to date on so many different events, then make sure you get on our mailing list. That's one of our primary ways of getting our information out. So you can go to our website, calvoices.org, and there'll be a link there to get on our mailing list. And then the last way to stay involved is to keep following this podcast as we put out our monthly episodes. Subscribe to it, share it with your friends and family. There's a lot happening at the state level that's impacting the public behavioral health system right now, and we want to get this information out to the people that it's impacting the most. And as Grace so beautifully said in our last episode, it's the people who are closest to the problems that can often be closest to the solutions. So if that's you, if you are part of our community and you or someone you love is being impacted by what's happening in our behavioral health system, then we want you to be able to join us and stay informed and advocate with us for those solutions.
Yes, that was so beautifully said, Jocelyn. Thank you for sharing all those dates. So please join us next time as we reflect on our conversations from the Los Angeles Behavioral Health Transformation Workshop and the impact specifically to the community planning process. And we will all see you in August for our next episode.
Bye, everyone.
Bye.